The idea to try to bring nurses back and healthcare workers back into the public system and retain them is the ideal, is the optimal. But the thing is how are we going to do this?
Health Minister Christian Dubé recently tabled a bill looking to stop the use of private agencies in Quebec's health network within 3 years. His goal moving forward, to retain and bring back employees into the public health sector. But for many professionals, the path to getting there remains unclear.
It's utopic in a sense. Let's get these people who've been working in private agencies back into the public sector and everything will kind of resolve itself. But that's not the reality.
Healthcare professionals have left the public system for private agencies for better flexibility on the number of hours they work, as well as higher pay.
It's the working conditions that are killing our staff, the nurses, the orderlies, everything. It's not just that we're paying the nurses too much as an agency nurse.
The rise of all these agencies is not the cause of what's going wrong in the health system. It's the consequence, because working conditions have degraded so much in the past few years, I would even say decades, that people are just voting with their feet, as we say, and they're going away.
For Melanie Jade Boulerice, taking away private agency nurses may be less costly, but removing healthcare workers who are helping to fill dire vacancies may put Quebec's health system in a more fragile state, and she's not alone.
These are not discussions for the bettering of the healthcare system. These are financial discussions. There's a big portion of nurses who are agency nurses that work at these institutions, and they can take up a good portion of the staff.
If you decide to regulate and change and start finding institutions for having private agencies that the government also put in place, right? The government is paying these private agencies. And now you're gonna punish CHSLDs and nursing homes for having private agencies. It doesn't make sense. Like, we really need to understand how we're gonna be hiring nurses back and PABs and LPNs back from the private system back into the public system.
In Montreal, Felisha Adam, City News.